Hello, I'm Rebecca Pigram, Public Information Officer for Rockingham County. Today we are joined by Rebecca Oakes. She's in our health department. It's Healthy Carolinians Coordinator, correct?
Yes, that's correct.
That is your correct title.
Yes.
Thank you so much for joining us today. We've seen nationwide an increase in opioid use and opioid death-related, overdoses and that kind of thing. And that kind of stems, I did some research, that kind of stems from an increased prescription use in the 90s. And that was before we knew that how addictive these pills can be. So in 2020, there were over 91,000 deaths, drug-related deaths in the United States.
Nationwide, yes.
Nationwide. Opioid-related deaths account for 75% of that. Again, nationwide. Can you kind of inform the folks at home, like Rockingham County's numbers in that?
Yeah, absolutely. So Rebecca kind of hit the nail on the head. This isn't just a Rockingham County issue. I mean, this is a nationwide issue. So, kind of a snapshot for here in Rockingham County, just to give the folks at home, like you said, sort of like a little snapshot, some recent data that we've gotten. So overdoses in 2020, we had 281 opioid-related overdoses in 2020, and we saw that go down in 2021, so that was 272 opioid-related overdose deaths here in Rockingham County. So far, I went and ran the numbers a little bit before you came over here. So far, as of May-ish in Rockingham County this year, we're at 102 overdose deaths related to opioid use, already in 2022. So, it is prevalent here in Rockingham County, but it's not just a Rockingham County issue. I want to, drive that home. It is a nationwide issue. Just a couple of other statistics that might be interesting for the folks at home. The average age of our overdose, individuals are around 47 years of age, and the average age of deaths due to opioid overdose are around 43 years of age. So usually like mid to early 40s.
Wow, I would have thought maybe younger. I don't know. I didn't even think about the average age, but that's relatively a median age. We've got a lot of young folks here. We also have an older population, so that is like right in that middle ground.
Right in the middle.
So what as a county are we doing to prevent these, to help folks at home, that kind of thing?
Yeah, so we have various different resources here in the county to help combat the opioid use that we're seeing here in the county and nationwide. Some things that we do have that people may have already heard of. We have an opioid task force here in Rockingham County made up of various constituents across the county from different backgrounds, organizations, government entities that come together to discuss and try and target the opioid issue that we're seeing here in the county. Not only that, we have 2 post-overdose response teams. I don't know if the folks at home know about those, but they're at the Eden Police Department and they're at the Reedsville Police Department. And what they do is they reach out to individuals 48 to 72 hours after overdose incidents, and they try to connect them with resources to help them combat their drug addiction, right? So whether or not they decide to do that is completely up to them, but the main thing is that we're trying to make sure that we connect them to resources to help them, right? We also have various other treatment centers here in Rockingham County that people may have heard of that they can get information from, but those are 3 of the main players as far as making sure that we're really hitting the ground running as far as the opioid epidemic here in Rockingham County.
Okay, so first thing that comes to mind, you mentioned something about there's 2 organizations or 2 groups that reach out to overdose victims, patients 48 to 72 hours, 48 to 72 hours after. That's incredible because that is, it's a follow-up. We see a lot of things where it's like, okay, maybe let's try and prevent, so we can't prevent everything. So when there is an overdose, there is that follow-up, and that follow-up is super important. Can you tell us those organizations again, just so the folks at home know maybe who they can reach out to, and so we can get that information out to the folks.
Absolutely. So both of those post-overdose response teams are at the Eden Police Department and the Reedsville Police Department. And like Rebecca just reiterated, they reach out to individuals post-overdose 48 to 72 hours, which is a very short window, right? They're on top of it. And they reach out to individuals who, again, have experienced an overdose, and they connect them to resources, places like Daymark Services. We've got Successful Transitions Integrated Healthcare here, A Beautiful Mind. So there's various different, not only mental health services, but drug addiction treatment facilities that we can connect them to help them.
Awesome. So a lot of people at home, let's heal this issue before it is an issue.
Right.
What are some proactive things that we are doing instead of reactive things we're doing?
So this is really exciting, Rebecca, because we have an upcoming project, or an ongoing project rather, I would say, to help sort of get community input about, what the community would like to see done as far as the opioid usage in Rockingham County, right? So the county is conducting surveys and focus groups to help glean a little bit of information from the public as to, again, their thoughts, opinions, knowledge regarding the issue, so that, again, we can know sort of their voice, their opinion, and take that into consideration whenever we're trying to come up with various projects, initiatives that help to target the opioid epidemic. And this is something that would be not something that we're telling people that we're doing. It's something that our Rockingham County citizens came up with, and that we took that data, analyzed it, want to see what they want to do, and do it.
Awesome. So you said this is an ongoing project. When did it kind of come to? When was the idea sparked, maybe, and then how have we evolved to kind of where we're going with this project?
So it's been an ongoing project. We started roughly around May with conversations being had on sort of where we wanted this to go, how we wanted it to look like. So again, really hammering home getting the surveys out to the community and organizing focus groups so that we can glean a little bit more information from the public. So again, we're getting a lot of public voice and opinion, and our future initiatives reflect what our Rockingham County citizens want to see.
Rebecca, thank you so much for joining us today. You've given us wonderful, hard statistics on both opioid use and overdoses. We should consider this an opioid epidemic, because it's a horrible, horrible thing that we're facing both as a county, but as a nation as well. You've given us ways that the county is being proactive, but also, reactive. It's that balance. How do we handle that? So thank you so much for giving that information to not only me, but the folks at home. If you at home have any questions, feel free to reach out to me. Again, I'm Rebecca Pigram, the Public Information Officer for Rockingham County. Give me a call, 336-589-0967. And again, I just want to thank Rebecca Oakes for joining me today with such valuable information for our citizens at home. Rebecca, can you tell folks where they can reach you?
Yes, so absolutely. So my name is Rebecca Oakes. Again, I'm the Healthy Care Liaisons Coordinator here at the Rockingham County Division of Public Health, and you can call me at 336-342-8258.